On today's episode of the Talking Shit Show, we're going to be talking about if you are pooping the right way. I'm so excited to share with you 3 tips today that will get you reducing your constipation, eliminating the strain that you're experiencing, the time in the bathroom, and the discomfort from maybe hemorrhoids or fissures. Coming up on today's Talking Shit Show. Welcome back, friends. It's Dr. Melissa Gallagher, and this is one of our most controversial series, my Talking Shit Show. I know a lot of you hate this topic, but we have to talk about it. Part of my naturopathic practice is to focus on the digestive process and how you poop, how frequently you're pooping, and all types of things like color, smell, the consistency. All of that is really critical for telling us what is going on inside your body. And I've had a lot of patients over the last 15 years that I've worked with have challenges with pooping. And come to find out in talking with them, they're not pooping the right way. There is the right way to poop and there's the wrong way to poop. And there's no judgment here, but I am hoping to help you eliminate the strain that you experience, the time that you're spending in the bathroom, discomfort from hemorrhoids and fissures, bleeding from the rectum, all of the challenges that a lot of you feel is a taboo or don't even want to discuss with your medical provider. We're going to dig into that today. So kicking off the right way to poop, there are 3 steps. Step number 1, really critical here, is to listen to the signal. And the signal is when you get that urge, the sensation that you need to eliminate, you need to move the bowels, you need to poop, listen to it. Okay, I know that sounds really like, oh my gosh, I can't believe she's talking about that. And some people will say, what signal? I don't have a signal. And others will go, oh my gosh, I can't because I'm at work or whatnot. So let me just kind of tell you the physiology and the way the brain, gut, whole process, communication pathway works. And this is often what gets kind of dysregulated and minimized over time. And we're talking sometimes decades. But let's talk about that signal. There is a signal, a little kind of pathway, a little signal in the rectum that tells the brain, hey, we have to poop. We've got contents we need to eliminate. It's time to go to the bathroom. Well, a lot of times, if you ignore the sense, that sensation, the urge, the signal, that signal will stop signaling. It stops working. We can reinvigorate that signal, but the most critical way to reinvigorate that pathway, the communication tool where the rectum tells the brain we need to eliminate, we've got to move our bowels, is to listen to the signal. And I literally mean, like, if you get that sensation, it's time to go. Because we're going to retrain the way your body is communicating, particularly to the brain. The brain center is our control panel. We need it to send signals to the rest of the body to do all the things we need it to do. Pooping being a big one. If you are sitting here watching this video and you're like, I do not get that signal, I have no sensation or no urge, then we need to go a little bit deeper, and I'll have a video that highlights that in the description that talks about how to kind of reinvigorate that connection. There are herbals, there are also supplements and things like that you can add to your diet, because there are a lot of you watching this that are probably dealing with dehydration and magnesium deficiencies and lack of fiber that'll add to a lessening of that signal. But 1, listen to the signal. Number 2, a squatty potty. Grab a poop stool. And this is really important because the structure of how we're sitting and the way the body is allowing for the contents to open and eliminate into a toilet bowl, it's minimized, it's not ergonomic. And we need to make the movement, the bowel movements and the act of pooping more efficient and more effective. Part of that is how we are aligning our body on the toilet. I know that probably sounds crazy, but simply a squatty potty or a poop stool. You don't have to spend a lot of money. I'll include some of my favorite squatty potties. Despite what you might think, there are many that are very attractive. They have bamboo ones. You can even use your kid's stool. You know, a lot of times kids will have to climb up on a stool to brush their teeth. You can use that. Whatever you use, I want you to use it every time you are eliminating, every time you get that urge, that sensation. Now, what do you do if you're at work? What do you do if you're out traveling? Well, there are a lot of different things that you could do. So I want to share with you some tips. One, if you are a lady and you've got a purse, even putting your, I know it sounds terrible, putting your purse on the floor and putting your feet on top of that. Other scenarios could be using the trash can, sometimes turning it on the side, or just even kind of placing it out. You can pop your legs up. We want to create the right ergonomic structure for an ease of bowel movements. This second tip is really going to impact all of you who experience fissures, tears, and hemorrhoids. Hemorrhoids, the act of straining to eliminate a bowel movement, is causing the vascular walls of the actual rectum and the anus to come out. And sometimes we'll have internal hemorrhoids, and most of the time people have the external. It's like these little cherries that come out, they will bleed, they'll tear, and it is extremely painful. This eliminates that need for preparation H or hemorrhoidal tucks or anything like that because you're in pain. So number 2, squatty potty and having the right ergonomic structure when you're actually pooping. Step number 3 is so easy. It is about breathing and tapping into the breath work and the function of the deeper diaphragmatic breathing to actually ease and relax the musculature of the lower pelvic region, and that will help ease an elimination through 2 of your anal sphincters. This is really critical, friends. There is an emotional component to pooping. And if you are a lady or even a gentleman, most of the time it affects us ladies. Comment down below if you can relate. When we travel, we're like, we're not pooping. There will be no pooping on this holiday trip, even if you're taking your magnesium and you're drinking all sorts of like detox elimination teas, which by the way, I have some video content linked down below about teas to avoid that are not good. So what happens, friends, and why breathing is really critical is that a lot of times people hold their breath while they're pooping. And I just want you to kind of get yourself in the situation of thinking about maybe your last bowel movement or experience where you've had constipation. It can be stress inducing, and the act of straining will often restrict breathing. That restrictive process, we have anal sphincters that also tighten up. Well, guess what? When anal sphincters are tight, there's no passing of bowel contents through those blocked pathways. So the anal sphincter needs to be in a relaxed transitional state where things can pass outward through that and into the toilet bowl. Breathing is the best and most effective way for you to achieve a relaxing of the anal sphincter. Now, this is something that I really have to admit. One of my friends, Andrea, who worked with me when I had a wellness center in Florida, she conducted hypnobirthing classes, and Brian and I went through hypnobirthing when we had Gabriel. And one of the things that we had to practice in preparation, we meaning us ladies who are birthing babies, we had to practice this particular type of hypnobirthing breathing, hypnobreathing. One of the things that they said for us to get to know what that felt like of this breathing to relax the lower pelvic region, i.e. a cervix, the vaginal canal, it's no different than the anal sphincters, people. We had to breathe into either the bowel movement or during childbirth into the contraction. That breathing into actually releases the tightness of those muscles, allows for what we want inside to come outside. And so for ladies, hypnobirthing brings the babies down and out. For breathing, this diaphragmatic type of breathing during a bowel movement helps you eliminate fully. I promise, I know it works. I promise. So comment down below if you're gonna try it. I know poop talk and talking about shit and bowel movements is still taboo, and a lot of you, it makes you uncomfortable, and I apologize. But when we are constipated, we have higher rates of cancer risk. We have higher instances of colon cancer. We're seeing more and more younger patients who are coming up with polyps and precancerous cells in their colon. We're also finding individuals having IBS and bowel imbalances. Moving your digestive process begins at the mouth and ends at the anus. It is really critical that we keep things moving out of the body and not recirculating. So if you are constipated, it's very likely that you'll have elevations in cholesterol, you will have elevations in triglycerides, and you will have imbalances in your hormones simply because those bowel contents are not moving out of your body. They're not getting evacuated through the normal process. And breathing, that third tip here, can help move that freely. And also, as the contents pass, guess what it does? It massages the signal. So this is all a cyclical process. I can't wait for you to try it. Please comment down below with any questions, and I hope you'll tune in to our next video. We're going to talk more about ways for you to resolve everyday imbalances that you might be experiencing. Thanks everybody, and if you haven't done so, please hit the subscribe, the like, and comment. Stay tuned for this shit-enhancing video.